Hello, I'm David Sanders, Executive Vice President of Systems Improvement at Casey Family Programs. It's my great pleasure to present this 2022 Casey Excellence for Children Leadership Award to Aysha Schomburg. She's the Associate Commissioner of the Children's Bureau in the Administration on Children, Youth, and Families, located within the Administration for Children and Families at the U.S. Department of Health and Human Services. Commissioner Schomburg took on this role in March 2021 after serving as the Senior Administrator for Program Oversight for New York City's Administration for Children's Services. During the COVID-19 public health crisis, she worked closely with New York City's Department of Education and Department of Homeless Services to create and coordinate guidance for frontline staff. In 2019, she was awarded the ACS Distinguished Service Award for assisting children separated from their families at the border. Commissioner Schomburg, congratulations on this award. We're pleased that you can join us for some conversation about the well-being of children and families, too.
Well, thank you so much, David. I'm really humbled and honored to be receiving this Casey Excellence for Children in Leadership Award. I just, it's been a long year, but a very productive year, and I really appreciate that Casey has been, watching and acknowledging and recognizing some of the work that we've been doing at the Children's Bureau.
Well, thank you. It's been a tremendous year for us in working in partnership with you. And as the Associate Commissioner of the Children's Bureau, you're essentially the top child welfare official in the country. So you're really in a unique position to impact child well-being across the nation. What are your biggest priorities as you set out during this last year?
David, thank you for acknowledging that. I mean, it is a really huge responsibility to be in leadership, with my colleagues across the country in terms of how we support children and families and, what we prioritize. When I started in this role last year, I spent several months just talking to my colleagues in the profession, talking to parents, talking to young people and advocates about, what was important, what is important for the now, what is urgent that we address. And, I can say that after, 20 years of working in government and in child welfare, a lot of what we need to address now is what we should have addressed in previous years. And in some cases, we know a lot more about what works best. And so I've outlined, 4 priority goals for the Children's Bureau. The first one, of course, is always prevention. Foster care needs to be an absolute last resort in every circumstance. And so the number one goal, I think, for our profession should always be prevention, keeping children out of the foster care system, keeping parents away from the foster care system, and supporting families as soon as we know that they need support in the way that they need to be supported, right? And so it sounds simple, but I think in general, there are so many more things that we can do to help families before they are at imminent risk, for example. The second goal is really about supporting kinship caregivers because, when in that last resort, a child or a young person comes into foster care, we want them to be with family. We want them to be with community to the extent possible. We know that when children are living with kin and living in their communities, that they do better, that their education is more consistent, that they do have better educational outcomes, shorter times to permanency and reunification with their family members. And so we want to make sure that we are giving kin the best possible opportunities to step up and take care of the children and their families. So that includes, more flexible licensing standards for kin and just making it easier for them to step up and be part of a reunification plan for children and youth entering into foster care. The third goal is really ensuring that youth leave foster care with strengthened relationships, holistic supports, and opportunities. This is what young people have told me that they need. They want to be recognized as young adults who know who their circle of support may be. And maybe for some, adoption is what is the goal. And there are other young people who have told me adoption may not be my goal, but I do have 2 or 3 or 4 or 5 or maybe even 10 people who I rely on as I transition out of care and into adulthood. And they want us in the field to recognize that, to recognize their relationships, to encourage them and to help them to be strengthened, that they want supports and they want opportunities, particularly opportunities around employment and around education. So I think there's some work that we can do when we think about how we support young people transitioning into adulthood and out of foster care. And finally, I've learned since I've been sitting in this role how critical it is that we invest in the workforce. And that really is our fourth priority goal. Like, our workforce in child welfare is in crisis. And, we know that there was high turnover even before the pandemic. The pandemic sort of exacerbated that. There are mass resignations in professions, all over the world, but there's also a mass resignation in our profession happening right now. And we need our social workers, we need our child welfare professionals, and so we have to figure out how we support them, how we recruit, how we retain, how we compensate the folks in our profession who are charged with supporting children and families, especially when they need it most. So we have to sort of show up for the workforce as well.
So thank you. I'm going to ask a couple of questions as follow-ups to that, and you can certainly choose how you want to order the response. So first, you mentioned hearing from youth, and you've had a very, I would say, comprehensive approach to listening to those who have lived experience. And I'm curious if you can say a little about that and how the input from those with lived experience has impacted your thinking about priorities. And then secondly, just a number of people have talked about prevention and how it's impossible to prevent child abuse or neglect, and that you really need to focus on safety. Can you talk about that too?
Yeah, I mean, first of all, what I'll say about, the impact of proximity to people with lived experience, and that includes young people who have been in foster care or somehow impacted by foster care, as well as parents who have been impacted by foster care or other ACF programs, Administration for Children and Family programs. It is to me, it's the number one priority. It's how I learn, how else am I going to know what needs to be done if I'm not talking to the people who have actually experienced it, right? They're in the number one position, frankly, to advise us in the profession of how, what needs to be addressed, and how we should go about it, what their experience has been, both positive and negative, what the challenges are, and how we might address those challenges. So it's really, for me, it's been central. It's the conversations that I love the most, the conversations that I'm having with young adults who can tell me about their experience in foster care, the conversations that I can have with parents who talk to me about, when their children were, taken into foster care, how they may have reunified, what they needed to be the best parent that they could be, where there were opportunities for systems, for example, to be helpful, but instead they were hurtful. So I think, that has been really core to how I approach this work. It's really just hearing from our families with lived experience in our programs, and again, not just foster care, but other ACF programs as well. And listen, I believe where safety is concerned and prevention is concerned, of course we can prevent it, right? We should prevent it wherever we possibly can. And you hear people talk about going upstream and helping families when they need help. And I think that that's what we need to do, paying attention to when a family says, hey, I need help in this area. I think also, and this administration has done an excellent job with talking about anti-poverty measures and helping parents when what they need is, financial support and being able to access the programs and the services that they need. And so, for me, when I think about our goals around prevention, for example, I think about, what the definitions of neglect, are across the country, what states are saying about what neglect really is and whether or not it's being conflated with poverty or not. And so I think about how important it is that we not make that mistake, right? That we not say that, a parent who cannot support her child or children, whether or not she's housing insecure, or there's a or there's an inability to provide, food or clothing, that is somehow neglect, right? We have to be able to call that what it is, which is poverty. And I'm careful because I know that sometimes neglect is sort of intersects with other things like substance use and mental health issues. But I feel like that's not neglect either, that we should help a family in addressing their need for substance use, that we should help a family where there's a mental health issue, and that we should be providing the services that any particular family needs, right? And that is safety, right? That is safety, providing what the family needs well in advance of any need for foster care.
Thank you very much for the conversation, and thank you for your leadership on the behalf of children and families across the country.
Thank you, David. It's
And
my pleasure.
thank you. Now let's meet our next award winner.